This is the Micro 6 3-question warm-up. First question, what's the time frame of the following steps of wound healing? So infiltration of macrophages and epithelial cell migration happens in the first 1 to 3 days. Remember, epithelialization takes place mainly in the first 48 hours. Granulation tissue occurs in days 1 to 3 also, and occurs especially at the wound edges. And then infiltration of neutrophils happens in acute inflammation in the first 24 hours. Next, what are the signs of left-sided heart failure? So left-sided heart failure is going to cause pulmonary symptoms like dyspnea on exertion, orthopnea, paroxysmal nocturnal dyspnea, and possibly pulmonary edema and Ralls on exam. And the last one, what genetic abnormality is commonly associated with endocardial cushion defects? This one's definitely important to know. It's trisomy 21 or Down syndrome. All right, let's move on to the lecture.
Hello everyone, I'm Dr. Shuford and welcome to our Step 1 video on gram-negative bacteria. Actually, this is the first lecture of 2 on gram-negative bacteria. There are so many little nasty gram-negatives, so many diarrhea-causing organisms that we can fill 2 whole lectures with them. So here we go. Enjoy. Let's get started with our gram-negative pathogen algorithm. We have provided a PDF of the blank algorithm so you can practice filling it out. This is similar to the one that we used with the gram-positive lectures. This is really high yield again. I wish it wasn't, but it is. So we'll go through most of it together as we make our way through this session. Now the first thing you need to remember is that gram-negatives look pink on gram stain. Remember that pink equals gram-negative. Okay, now look at the algorithm and let's talk about the gram-negative cocci. So what does this include? It includes Neisseria meningitidis, Neisseria gonorrhea, and Moraxella catarrhalis. Now, all of these are oxidase-positive bacteria, but it may be helpful to know how to differentiate these 2 clinically significant Neisseria species. Neisseria meningitidis is a maltose fermenter, and Neisseria gonorrhea is a maltose non-fermenter. Next are the coccobacilli, or coccoid rods. These include Haemophilus influenza, which we'll talk about more in a few minutes, Bordetella pertussis, which causes whooping cough, Pasteurella, which is common in cat bites, and Brucella, which causes brucellosis. Next, we're going to move on to the gram-negative rods, also known as bacilli. You can differentiate these by their ability to ferment lactose. So the lactose fermenters are pink colonies on MacConkey's agar. Then these pink lactose fermenters can be further differentiated by being a fast fermenter or a slow fermenter. One way to remember the fast and the slow fermenters are by thinking of the word MacConkey's. If you change the final Y to an E on MacConkey's and capitalize the CKEES, it may help you to remember the lactose fermenters as well as the fast and slow fermenters. I think it's helpful anyway. So the C is for Citrobacter, the K is for Klebsiella, and the E is for E. coli. The second E is for Enterobacter, and the S is for Serratia. The 3 in the middle, the KEE, those are the fast fermenters. And the 2 on the ends, the C and the S for Citrobacter and Serratia, those are the slow fermenters. Now, those were our lactose fermenters. They turn pink on MacConkey's. What about the lactose non-fermenters? Well, these are going to be white or colorless on MacConkey's. They can be further differentiated into either being oxidase negative or oxidase positive. So the oxidase negatives are Shigella, Salmonella, and Proteus. The only oxidase positive non-fermenter that we're going to talk about is Pseudomonas. We have another subcategory of gram-negative bacteria that have a curved shape. The 3 bacteria in this category are Campylobacter jejuni, Helicobacter pylori, and Vibrio cholera. Campylobacter can have more of an S shape, and Vibrio is described as having a comma shape. They're oxidase positive. 3 other facts that might be useful to know: Campylobacter jejuni grows in a relatively warm environment at 42 degrees Celsius. H. pylori produces urease, and Vibrio cholerae grows in an alkaline media. So that's the gram-negative algorithm. I wish there was a really quick way to memorize it, but the truth is you're just going to have to stare at this for a little while and fill in some blank algorithms on your own till you're comfortable with it. For now, let's press on and learn a little bit more about these gram-negative organisms. But don't worry, we're not going to cover all of these in this lecture. We are going to spread the joy of gram-negative pathogens over a couple of lectures. All right, let's begin. Look at this image. It's showing you some gram-negative cocci. Actually, it might be better described as showing diplococci. When you hear diplococci, you immediately think strep pneumo, but that would be gram-positive diplococci. And while we're on gram-positives, do you remember what you're supposed to think if I say gram-positive clusters? Well, that should make you think staphylococci. But now these are gram-negative diplococci. That should make you think Neisseria species. These ferment glucose and produce an IgA protease. The two most important species for you to remember are Neisseria gonorrhoeae and Neisseria meningitidis. And though these share a genus, they have a whole lot of differences. First, we have Neisseria gonorrhoeae, or gonococcus. This is primarily a sexually transmitted infection. Once mucosal infection is established, it can travel hematogenously and cause septic arthritis. If a 21-year-old sexually active person comes to your office with septic arthritis, the first three things on your differential should be gonococcus, gonococcus, and gonococcus. Now, babies can be infected while traveling through the birth canal and can get conjunctivitis. As we mentioned before, Neisseria gonorrhoeae is a maltose non-fermenter. Also, you should be aware that it does not have a polysaccharide capsule. Now, as for treatment, we use a combination of ceftriaxone and azithromycin. This combination is intended to try to overcome resistance issues that are becoming an increasing problem with gonorrhea, as well as cover any coexisting chlamydia trachomatis infections. Now for Neisseria meningitidis, or meningococcus. Unlike Neisseria gonorrhoeae, Neisseria meningitidis is a maltose fermenter. It has a polysaccharide capsule and it can be transmitted by respiratory secretions. This is a very, very, very bad bacteria. It probably won't surprise you that Neisseria meningitidis causes a lot of meningitis, but you need to know that it can cause meningitis alone, it can cause a bloodstream infection alone, or it can cause a combination of both. It's a common cause of bacterial meningitis in children and young adults and has a mortality rate between 10 and 15%, so it's a big deal. When the infection is in the bloodstream, it can cause disseminated intravascular coagulation, purpura fulminans, and shock. Now, it's the disease that's associated with Waterhouse-Friderichsen syndrome. And what's that? Remember that that's an adrenal hemorrhage that's due to overwhelming infection with Neisseria meningitidis. Luckily, there is a vaccine for meningococcus, and recently there has been a new serogroup B meningococcus vaccine licensed for use in the United States. Rifampin, ciprofloxacin, and ceftriaxone can be used as prophylaxis in people who have close contact with infected individuals. Treatment for overt disease should be implemented immediately and empirically. You do not wait for culture results in these people. Use ceftriaxone or cefotaxime, and you should only use penicillin G if you have sensitivity data showing that treatment will work. Okay, let's talk about Haemophilus influenzae. Remember that Haemophilus influenzae, or H-flu, is a coccobacillus. Influenzae is a bit of a misnomer. This was named years ago because they thought it might be the cause of flu, but it's not. Haemophilus influenzae is a bacteria, and the influenza virus that causes influenza is obviously a virus. So what infections can Haemophilus influenzae cause? There are two really big ones to remember that have been drastically reduced by the Haemophilus influenzae type B vaccine, and those are epiglottitis and meningitis. Here's a photo of a child with epiglottitis. Now, epiglottitis occurs when the epiglottis becomes inflamed, which can then cause airway compromise. What you see is a really sick kid with difficulty breathing and swallowing. They may actually be drooling because of the difficulty swallowing and breathing, and this can make them very anxious as well. Now, there's something called the sniffing dog position. They kind of stick out their neck, trying to open their airway more so that they can breathe. On examination, you may see a very red and inflamed epiglottis. On x-ray, you may see something called the thumb sign, which is caused by the edema of the epiglottis. So one thing you need to know is what to do for a kid that you think has epiglottitis. This does show up occasionally on tests. And most of the time, the answer is going to be something like, make the kid comfortable and don't do anything. You shouldn't go poking and prodding a kid with epiglottitis until you have a plan to secure that airway, which means being able to rapidly intubate them. Worst case scenario, which is what we always have to think about, right, is that they start crying and they lose their airway and then they die. Now, meningitis is the other big one that I mentioned for H. flu. It used to cause a ton of morbidity and mortality in kids prior to that Hib vaccine, but we hardly see any H. flu meningitis in the United States now, thank goodness. Now, I keep talking about Haemophilus influenzae type B, and this refers to a specific serotype of H. flu. The 6 serotypes of H. flu all have capsules and can be differentiated. There are also a number of non-typable strains of H. flu. Now, these strains don't have capsules, but they are still major causes of disease. These strains cause a lot of sinusitis, otitis, and pneumonia. A couple more things to remember about H. flu. It produces an IgA protease, which can probably help it to cause those mucosal diseases that we see. Now, if you want to culture this, you have to culture it on chocolate agar, and it requires factors 5 and 10 for growth. One other Haemophilus species is Haemophilus ducreyi, which causes the sexually transmitted disease chancroid. What you see is one or several painful ulcers that are often associated with inflamed inguinal lymph nodes. Now, don't get chancroid confused with syphilis. Syphilis causes a painless ulcer, but the Haemophilus ducreyi ulcer is painful. Just remember that patients with Haemophilus ducreyi do cry over the pain in their chancroid ulcers. Okay, now let's move on to Legionella. Legionella is another gram-negative rod. We didn't cover this one in the algorithm because it has some unique qualities. It's most well known for causing Legionnaire's disease, which is a severe atypical pneumonia with fever. It's frequently associated with GI symptoms like diarrhea. Now, there is another clinical presentation of Legionella infection called Pontiac fever, and this is more of a mild flu-like illness that resolves without treatment. Legionella can be difficult to diagnose. It doesn't grow on routine culture media, but it grows best on buffered charcoal yeast extract agar, and it requires iron and cysteine to grow. And though it's a gram-negative rod, it gram stains poorly because of this unique lipopolysaccharide in its outer membrane. It may be visible on silver stain, but even that can be low sensitivity. Now, there's an old mnemonic that's been used for ages to help remember all of these characteristics. You can imagine a French legionnaire with a silver helmet, which should remind you of the silver stain, standing by a campfire, and that's where we get our charcoal, and with his iron dagger, he's no sissy, and sissy should remind you of cysteine. So we're getting most of the unusual aspects of Legionella here. We see the silver, charcoal, iron, and cysteine. It's a bit of a stretch, but sometimes the weirder the thing, the easier it is to remember. Because of the complexity of growing Legionella, we often try to detect the presence of Legionella antigen in the urine for a quick diagnosis. The only problem with this approach is that it detects only serotype 1 of Legionella pneumophila. Thankfully, the bulk of clinical disease is caused by this serotype. Now, for transmission, this is super important, so concentrate here. Legionella is spread through aerosols from environmental water sources. There's no person-to-person transmission. You may read a scenario on a test where several people get pneumonia and they've all been exposed to a common air conditioning system or sprinkler system or some sort of water feature. Now, the treatment is a macrolide like erythromycin or azithromycin or a fluoroquinolone. All right, next we're going to move on to Pseudomonas aeruginosa. This is yet another gram-negative rod, and this is an important one to know. There are a few hints that will be given to you in test questions and in real life to alert you to a Pseudomonas infection. Pseudomonas is a lactose non-fermenter that is oxidase positive. It produces an unusual blue-green pigment, and it has a fruity, sweet smell to it. Pseudomonas is a real problem in certain populations. It causes a lot of ventilator-associated pneumonia. It also colonizes the airways of cystic fibrosis patients. Other places that you're going to find Pseudomonas is in wounds of burn victims and in hot tubs as the cause of hot tub folliculitis. It might help you to think about Pseudomonas loving the water and loving the air. Air because it's oxidase positive and it causes a lot of lung problems, such as ventilator-associated pneumonia and colonizing the abnormal airways of CF patients. And water because Pseudomonas loves moist environments like burns and hot tubs. It produces a blue-green pigment that looks like water. So when you think of Pseudomonas, think of air and water. This bacteria has many virulence factors, including exotoxin A, which inactivates the elongation factor 2, and this results in a lot of cell necrosis. So how do we treat it? Treating Pseudomonas is a tricky business. Pseudomonas has the potential of being multi-drug resistant. So if a person looks really sick or you suspect a drug-resistant Pseudomonas, then you can start 2 anti-Pseudomonal drugs with the hope that at least one of those will be active against the Pseudomonas. The only class of oral medication with anti-Pseudomonal activity is the fluoroquinolone class, meaning something like ciprofloxacin or levofloxacin. Ticarcillin and piperacillin are anti-Pseudomonal, as are cefepime and ceftazidime. The carbapenems, imipenem, and meropenem are also active against Pseudomonas. Now let's move along to the next important gram-negative rod, Helicobacter pylori. Now this is an important one for you to remember as well. It's a spiral-shaped rod that is urease positive. Remember that part about urease. We use that characteristic to test for the presence of this bacteria. You can use a urease breath test or a urea breath test or a urease test on biopsy specimen. Other diagnostic tests include serology, and that's just looking for the antibody, or the stool antigen test. You can also look at tissue to just try to see the organism under the microscope or even try to grow it on culture from a biopsy specimen. Now, this bacteria causes a lot of problems, including gastritis, and is associated with duodenal ulcers, gastric adenocarcinoma, and gastric mucosa-associated lymphomas. So this is one of those few instances where we have seen bacteria increasing the risk for cancer. So how do we treat this? H. pylori is another tough little guy, so we have to use several drugs to get the job done. There are several different versions of the triple and quadruple therapies for H. pylori. The standard triple drug regimen for H. pylori includes proton pump inhibitor like omeprazole, clarithromycin, and amoxicillin. If the patient is penicillin allergic, and then you can substitute metronidazole. Quadruple therapy usually combines 2 antibiotics, metronidazole and tetracycline, with a proton pump inhibitor and bismuth. Okay, that is it for our first session on gram-negatives. Now it's time for the end-of-session quiz. So go ahead and turn off that video, answer the questions, and then restart the video so that we can go through those answers together. All right, let's go through those answers to the end-of-session quiz in your study guide together. The first question, a gram stain reveals gram-negative oxidase-positive diplococci. What's the likely organism? So this is going to be one of those 3 things, and if they give you any clinical information with the question, it will help narrow it down to 1. If the stain is on a sputum from a COPD patient, then you should be thinking Moraxella catarrhalis. If the stain is of urethral discharge in a sexually active college student, then it's going to be Neisseria gonorrhoeae. If it's a stain on CSF culture from a patient with rapidly progressive meningitis, then you need to be thinking Neisseria meningitidis. A 22-year-old medical student has a burning feeling in his abdomen after meals. An EGD is performed and biopsy of the gastric mucosa shows spiral-shaped gram-negative bacteria. So what's the organism? Of course, this is going to be H. pylori. A 50-year-old male smoker presents with new cough and flu-like symptoms. Gram stain of the sputum shows no organisms, but silver stain shows bacilli. What's the diagnosis? Now this is going to be Legionella pneumophila. Legionella does not gram stain well, but you may be able to see it using silver stain. How do we normally identify this? The patient comes in with pneumonia and you can check a urinary antigen test for Legionella. What gram-negative organism matches these following descriptions? Sepsis, DIC, and adrenal hemorrhage. This is Waterhouse-Friderichsen syndrome of Neisseria meningitidis sepsis. 5-year-old with pharyngitis, drooling, and x-ray revealing a thumb sign. This is classic epiglottitis of Haemophilus influenza type B, which, again, we don't see much of anymore thanks to the Haemophilus influenza type B vaccine. Burn wound infection. This is classically Pseudomonas. Life-threatening meningitis plus purpura. Again, you need to think Neisseria meningitidis. Septic arthritis in young sexually active patients. Remember Neisseria gonorrhoeae. And that is it for our end-of-session quiz, and that's it for our first session on gram-negative bacteria. I'll see you next time.
Welcome back to DIT TV. We've got more rad music coming up in just a minute. But don't forget that this Friday night, our guest VJ will be none other
than Dr. Chris Lewis, who's going to be playing some of his favorite videos. And we're going to have the world premiere of the new single, Don't Pick My Ass Car,
from Anthrax. So be sure to catch Dr. Lewis this Friday at 10 p.m. Eastern, only on DIT TV. Sponsored in part by New Coke.
Love me some New Coke. It's going places, I think. But right now, here's the title track from Billy Spinell's new album, on Gram-Negative Records. It's called Pseudomonas. And hey, it's in stereo. Only on DIT TV.
Saw a patient today with Pseudomonas. He's got cystic fibrosis and bad pneumonia. Got a girl with hot tub folliculitis. Diabetic with osteomyelitis. Don't feel alright. I said yeah,
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 yeah.
yeah. You make me feel
Pseudomonas.
so bad,
Pseudomonas.
so bad.
Pseudomonas.
I don't feel alright tonight,
Pseudomonas.
tonight.
Pseudomonas.
Gonna die.
Pseudomonas.
Gotta say bye-bye. I said yeah,
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 Yeah.
yeah,
Yeah.
yeah, yeah. It's oxidase positive but won't ferment lactose, and makes greenish pus wherever it grows. It makes exotoxin A blocking EF2. What can I do? I said yeah,
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 yeah.
yeah,
Yeah.
yeah,
Yeah.
yeah. Need some piperacillin with
Pseudomonas.
tazobactam,
Pseudomonas.
cefepime,
Pseudomonas.